Dr. Jeff Kalkstein with Kalkstein Chiropractic office in Towson, your Baltimore area chiropractor, and I'm with Karen this morning. And Karen's been coming, what, 2 weeks now?
About that, yes.
Yep. And Karen, who referred you in?
Mark Saba, my primary care.
And you had gone to some physical therapy before that, and you had to take a break from that for family reasons, is that right?
Friend.
And then why did Dr. Saba send you over here? Well,
because you had worked wonders on his shoulder, and he said, they do chiropractor, chiropractic, whatever it's called.
Chiropractic.
And they do physical therapy, and they also do dry needling. And he said, so you can get the whole thing in one fell swoop. And I'd been worried about my posture, and it was painful, my spine. So I'm feeling much better, and I'm working hard.
So it was the posture issue, but it was also a pain issue that brought you in.
Yes,
right?
yes.
And if you listen to the patients, they'll open the door for you sometimes. And you said to me you couldn't do what pose in yoga?
I couldn't do lotus pose. I cannot sit.
What's lotus pose for everybody?
Cross-legged, Indian style.
Sitting.
Yes.
And so we started working on that, and I think what we'll do is we'll do this video where we're adjusting, but we'll go back and show you all how she's getting better at her lotus pose, right? So we started a stretching program, right?
Yes.
And you do it at home too?
Oh yes.
Right.
Faithfully.
Right. And what else do you do outside of getting adjusted and the stretching exercises?
I take yoga twice a week, and I go to a fitness class twice a week, which involves aerobics, weights, and stretchy bands. And I walk.
Does that mean you do yoga and you go to the exercise class and you walk?
Yes.
So you're doing something maybe 6 days a week, 7 days a week, five.
Yeah.
So that is awesome. That's awesome. So, have we helped you with your back pain?
Yes.
Yes. And your lotus pose is getting better.
Slowly, but it's getting better.
And so we'll adjust now. And I think what I want to do as we move forward is we have her on it's a lower extremity, and we've introduced how many different stretches for the lower part of your body?
3.
3, right. And are you starting to get your arms around those 3 stretches?
Oh yeah.
You ready for more?
Yes.
So we'll introduce those to our next visit, and then I think the other thing we're going to do is we're going to start you on a posture program, because I think we can do those in combination. Then I think we're really meeting some of your long-term goals.
Okay.
And this is great, everybody, because Karen's willing to do the work. She's outside the office. She's active 5 days a week, right? Which is tremendous, and that's what you have to do. You have got to move.
Keep moving.
If you don't keep moving, the hinges are going to get rustier and rustier and rustier, and you're going to be doing less and less and less, right?
Yes.
So we've already adjusted one side. Let's adjust the other side. So you're going to be on your side towards me, correct?
Yes.
So next visit, when you come in, we'll introduce the posture program, and then we'll add a few more stretches.
Okay.
And the sequence of adding the stretches is I gave her one exercise to do when she first came in. And how many times did we do it? Like 6 or 7 times in a row?
Yes.
We'd hold it for a couple minutes, right?
And then you give me that 1 minute break.
And then you'd let the blood get back into the tissues, and then you do it again. And you've been doing that now for probably 3 weeks.
2 or 3 weeks.
And do you find yourself getting into the pose quicker?
Yes, and not going, oh gosh, I have to do that again.
Yeah.
The time goes fast.
Yeah. So I'm doing the same stretching program, and I'm not I still struggle with some of those poses, and I'm going like, oh my gosh, how can I stay here? And it's a good mind exercise too.
Yes, it is.
And I think that's where yoga and the breathing helps, not just yoga breathing, but we teach people to breathe here, and I think that really helps. So relax for me. Yep, let me have this arm back up here. And then look down, let that nice and loose.
Oh.
There you go, on your back for me. And then we'll adjust your hips.
And it doesn't hurt as much when you adjust me.
Oh,
that one did.
beautiful, beautiful. And then hands over your head. So I should have you go out there and do one of those poses and see how that feels. Because that's the best your hips have released since we've been doing that, right?
Yeah.
They really did.
Yeah. I could feel that.
So why don't you go out with Liam and show Liam your first pose, where we sit cross-legged and we lean, and let's see how that feels after adjusting you compared to what you started with when you first walked in the door.
That sounds great.
So Liam, let's go out there and get some photos out there.